prayers. Wachoni nie pinamia, my life. Thank you very much for my life.
I have relatives across the whole reservation, so all of these are really my people.
My people have been decimated 97%.
Through all of that, we are a resilient people.
Yeah.
We are a strong people.
The resilience, the togetherness, the strength that we have as a community.
I'm hoping that by my helping with the mental health needs here, that not only my son, but every other child has an opportunity to grow and to experience how beautiful our area is.
Fort Peck was a suicide cluster. Back to back, we were losing suicides in that time. My son was one of them.
Historically, Roosevelt County has always been painted in red for some of the highest rates of suicide.
I was about 7 months pregnant and my sister completed suicide.
So we need to do better because parents should not be burying our children.
And one of those voids is mental health, which I believe is the primary problem in Indian country, because I believe all Indians, as a result of historical trauma, experience PTSD.
We're pretty stingy with our people because there's not very many of us left, so in order to survive, we have to help each other. And that's the spirit of my intention of being in suicide prevention. I've been a part of it for a number of years. This is the greatest culmination of help that I've seen in the community, where we're dedicating a lot of resources and there's a lot of people that are waiting to hear from people in crisis.
We focus on the children, we'll be able to change generational cycles, we'll be able to address generational trauma. We have school-based health clinics all across the reservation.
We are an intensive outpatient facility. I think every family just about has some type of family member that has addictions.
So the coalition really wants to pick up the ball for where those connections are falling and help people flow through the system to get true help and to break the cycles that they're in with crisis.
Good afternoon, Suicide Prevention Call Center. Are you experiencing any suicidal ideation right now? One of the greatest tools that we have is Solace. And that's one of the most unique aspects of the Fort Peck 988 Suicide Prevention Call Center, is that we're actually following up. We're not just a line that somebody can call and we can talk you down from your ideation. We're following up with some solutions. It's a great individualized anonymous service available 24/7, 365 days a year to connect you to mental health and substance use treatment providers, regardless of insurance.
If I drove from Fraser to Poplar, that's almost a 50-mile trip for me to receive possible mental health services. So with Solace, I can access that anytime and privately.
You know, at the time when I was going through everything, I would have definitely been calling Solace for whether it was a therapist or a counselor or, whatever mental health provider.
The more I went to therapy, the more I was able to deal with my trauma. It helped me to heal in so many ways.
Why not? Why not try to see what it can do for you? Who knows whether that can change your life or not?